Hello, everybody. Hello. Thank you for joining us. Welcome to Thyroid Wellness 101. We are excited to answer all of your questions today. Just a brief intro on me. I'm Katy Whalen, the founder of Joy Women's Wellness. I started Joy after I went through a really rough period of my life trying to have babies older. When I was 42, I had my second baby. And so basically, I was trying to recover from a lot of trauma right as I was walking into perimenopause. For me, I
Response,
am
Katie.
very, I am very grateful because I had help. I had expert help. Um, for me, being proactive, actually, thyroid was one of the first things I got on and then was able to get off. Getting on HRT, that all helped me like so much, dramatically changed my life and got me to a place where I felt like I had energy again and I was myself again. So for me, that was why I started Joy to give access to that to other women. And from the beginning, there was Dr. Melissa Losky. So Melissa is a trailblazer in functional medicine. And she has a clinic in Omaha, Nebraska, my home state. And
Yay.
she treats both men and women, and really just helps people feel better, balancing hormones, improving thyroid, sexual health, all the wonderful things. So, Melissa, I just wanted to say thank you for always being there for me, for being our medical director at Joy and Blokes, and also for being here just to answer questions for people today.
Always. We've been having this conversation long before talking about hormones with school.
That's true. Yeah, thyroid has for sure. So we got a few questions from the audience before that we're going to start with, but also, Riley, they can just type their questions in the chat too, right? So
Yep,
we can be sure to
chat
get
is open.
everybody. So we'll start off with some basics and then some questions and then get right into your questions from the chat as well. So first, just briefly, can you just tell us what's the thyroid? Why do we care? What does it do?
So, thyroid, I always like to call this like command central, master metabolic gland in the body, sits right here in the middle of the neck and basically controls almost all of your metabolic functions throughout the body. That's my high level with everybody.
So it's a big deal.
Command central. It's a big deal. And when it's off, you can feel off in so many different ways, but it's also one that is a very, very delicate balance. So there are, and this is a really hot topic, and I know Katie, you and I have talked about this a lot. I hate the word normal because you could take a thyroid level and there's a whole bunch of different ones, but normal's not always optimal. So I've had so
Right.
many gals who, well, but my primary care told me, somebody told me this was normal. That doesn't mean that it's optimal for you. And that sweet spot for thyroid for each individual can be a very narrow range.
And that's a good point you bring up because I have talked to a lot of people who say, "Oh, my thyroid's normal," and I
Yep.
say, "Well, what have you tested?" Because most, when you go generally to your general practitioner, they test
SH.
TSH, but
Yep.
sorry. So
Yep.
anyway, our advanced panel has a full thyroid, which I think is like seven-ish markers.
Yep.
Can you tell us why that matters? Why can you just not look at TSH?
So TSH, and let's be very clear here. This is not a negative at all against primary care practitioners, gynes, anybody else who, if you as patients have seen and you're raising your hand saying, yep, all I had was a TSH. We're just not trained to look more extensively. That's things that we as practitioners have to educate ourselves on outside of what we learned in medical school, PA school, NP school, etc. So why is it important to have a more expanded panel other than the TSH? So TSH, signal in the brain that tells the thyroid gland what to do. If that's all I'm looking at, I have no idea, am I actually producing enough thyroid hormone to make the body happy? Yes, I may have enough T4, but do I have enough T3? Did I look at reverse T3, which is a response to stress? Do I have antibodies, which could indicate an autoimmune issue? So if you're looking at just the TSH, you're looking at things in such a vacuum that you're never going to have that whole picture of what the thyroid gland is really doing. And because it requires such that sensitive and delicate balance, it also doesn't tell you how is the body responding to what I've done.
Okay. Okay. Great. And that's a great explanation of why you need more than just TSH. Okay. So, first question, gut health and how does that intersect with thyroid function? Does that affect one another?
The simple answer is yes. Gut health is absolutely critical to thyroid health. If your gut is not healthy, your thyroid is going to respond appropriately. And that can be one direction or another. And I always like to say I wanted to ignore the gut for as long as I could, but the gut is so, so, so important that it's going to impact everything you do. So
So, would you start with fixing your gut? Would you start with thyroid? Would you do both at the same time?
I'm a really big proponent and believer in meeting somebody where they're at. I mean, if your diet is carb heavy, and I know that that's trashing your gut, but your TSH is high, which would mean your thyroid is underactive, I can talk to you all day long about dietary changes, which number one, typically don't happen overnight and take time to make that adjustment. So if I've got a, let's talk gals here for the moment. If I've got a gal who is clearly or clinically hypothyroid, meaning her thyroid is underactive, and we have a discussion about her gut, she may not care about making food changes because she's like, Melissa, I can't even get out of bed to get through my day. Like, let me get through my day and have that mental clarity so that I can focus on the bigger changes I need to make. So a lot of times it ends up being a combination of both. Let's get you started on some medications that support that first.
Okay.
And then while we're doing that, we can make the lifestyle changes that we need to make and drop dosing as we go through.
Okay, that makes a lot of sense because one thing that I mean, I assume, and you can correct me, most people are hypothyroid, right? Is that the majority or no?
Yes, generally speaking, it's hypothyroidism.
So that means you're not making enough,
You're
go-
underactive. It's underperforming.
underperforming. So that, and also that is like, I don't have energy. I'm so tired. I'm lethargic.
Correct. And I'll get that a lot too from a hyperthyroid state. So hypo, I usually equate it to, this is like being knee deep in quicksand trying to get through your day. So think of
Okay.
all the things. This is constipation, skin changes, hair changes, fatigue, just that low motivation, potentially difficulties with sleep. It's just a very slowed metabolic system. So just think of
Okay.
anything that is slow and sluggish.
Okay. I kind of like this question. Oh, well, first of all, let's start with Holly. Okay, because this is also a good one. How do you know if your gut health is off?
I and again, I'm a little sensitive here because I know we just had an election in this week. But the statement I'm going to say is I promise not politically mediated. People, we live in America. Your gut health is almost all of us have crappy gut health
Mm, wow.
because of how processed our food is, the things that are in our food. It's very difficult. And I'm a mom to three, so I get it. It's very difficult to, most of us don't have our own cattle. We don't raise our own meat. We don't grow our own garden. Like we're
Right.
not eating wholly from the land. So as much whole food as you can do, fantastic. The healthier your gut's going to be, the less you're buying from the pre-packaged processed food, the better your gut's going to be.
And ultimately, like that comes out and shows like in your bathroom habits, right? So if you can't go or if you're going too much, then that is a gut health issue or no?
Can, but not always. Sometimes for people, gut health is low energy. It's brain fog. It can manifest in a lot of different ways.
Mm,
And because we've eaten how we've eaten for so long, we don't realize how much it's contributed until we start to reverse those things.
yeah. So Ollie's following, even if eating carnivore, ketovore. So, but like that wouldn't cure gut health, I would assume, right? So,
Not necessarily. So if you're going to be eating all meat, the carnivore diet, you can create a whole different host of issues. You can get iron excess. It's everything's in balance here. What I always try and tell everybody is aim for the appropriate amount of protein for your body, which we loosely say is 1 to 1.5 per body weight. So grams, that would be in grams. So I personally, because of my activity level, generally aim for 120 to 140 grams of protein a day. Now, again, as a mom, there's no way I can eat. I don't have time to make 4 eggs for breakfast, cook something for lunch, again, have another protein for dinner. So sometimes, yes, that is it's a smoothie, it's a drink. There are a ton of other ways to get small amounts of protein from that perspective. But your gut also needs fiber and other nutrients that you're not going to get just from eating protein.
Okay. All right. So you touched on optimal versus normal range. So Elizabeth wants to know the range right now is 0.5 to 4.5. So I'm assuming that's talking about TSH. Is that
That would be a TSH range, and that varies per labs, but that's a yes, that's a general range.
so she was told she was normal at 2.1, but very tired, taking naps, having a hard time waking in the morning, which was not normal for her at all. So do you have I mean, if that's the normal range, what would you say is optimal, or is there something?
I'm fairly close in that range. I will loosely say 1 to 2 for a TSH, but just because her TSH is normal doesn't tell me what does the free T3 look like, what does her T4 look like. If your TSH may be great, which is going to tell your body and recognize, okay, do I have enough thyroid hormone in the body? Usually the higher that TSH is the brain's way of saying, hey, the body or the thyroid gland aren't giving me enough of the critical thyroid hormones I need to produce. But she may be making enough T4 that the brain says, I'm getting by okay, but she doesn't have enough free T3 or T3 circulating in the body. Or if stress is high, it may be that she's binding up her T3 with reverse T3 and not able to actually utilize the thyroid hormone she has. And then always my dot, dot, dot is you can't look at thyroid in a vacuum, meaning your insulin levels, your cortisol levels, your other hormone levels are all going to be impacted to your thyroid gland as well and how your thyroid is functioning. So just
Mm,
because your thyroid has been, quote, normal doesn't mean that your testosterone is, that your progesterone is, that your cortisol levels are healthy.
right. That's kind of the whole point, and which probably makes thyroid confusing is it's a big
Right.
deal. Then there's also like obviously at Joy we do a bunch of hormone therapy, and uh
Correct.
so you could have similar symptoms for thyroid, other sex hormones,
Correct.
gut health. I don't know.
Yep.
There's lots of like things that
Over.
like,
Yes.
yeah. So sorry that that's not an easy answer, but that obviously the point is what do the other markers look like, Elizabeth? And what else have you seen
Yep.
from the rest of your lab?
Yep.
Uh,
And that's where I would tell her too, like, okay, great, your TSH looks normal, but the number one thing I'm going to want to see next is a free T3, which is so from the thyroid gland, you're going to produce T3 and T4, which are your thyroid hormones. T4 breaks down into T3, and that process happens in the liver. So again, if we're having some issues converting, it can tell me a little bit about how is our liver functioning? How's our liver detox happening? But T3 is the lock and the key. T3 is going to be the actual thyroid hormone, the active thyroid hormone that's going to go out into the body and turn on all those metabolic functions. So
okay.
if you don't have enough T3, your TSH may look perfect, but you're not going to have the experience from a symptom standpoint of actually feeling like your thyroid is working appropriately.
So this might be some sort of similar. Stacy's asking, can you have hyper TSH and still be low in free T3?
Yes.
Okay. Which
Yes.
reference is more important? Again, I don't know.
Well, I can't say that there's just one, but to me, a TSH is worthless without a T3.
Okay. Okay.
I mean, that for me, that would be like looking at an FSH for a female, but having no idea what her estrogen looks like.
Yeah,
Those
you can't
two
have one
paired
without the
together,
other.
correct. Those two pair together.
Okay. Great. Joanne's asking about thyroid globulin antibodies test came up 11H. I don't know what 11H is, but waiting for her doctor to go over with it. Is it a concern?
So her TPO, thyroid globulin TPO, yeah, TPO antibodies is your typical one that we typically end up checking for autoimmune, a thyroiditis, often pretty common from a Hashimoto standpoint. So this is an underactive thyroid, but because you have auto antibodies, meaning your body is creating antibodies that are kind of, I don't want to say the word attacking, but attacking is what we hear a lot of times, that you're attacking your own thyroid gland or your own thyroid hormones to try and regulate whatever's happening from an autoimmune standpoint.
Hmm. So, I mean, it's good, Joanne, that you've got another appointment to go over that, right?
Correct.
dig farther into what's going on.
We have seen a dramatic uptick in autoimmune diseases post-COVID, whether from gals who have had COVID, have been vaccinated as well. Those are all things that we've actually seen that can increase that uptick of autoimmune diseases. So clearing inflammation out of the body, and again, a lot of that can stem from improving gut health as well,
Mm-hmm.
are
Okay.
also other things to look at. And what I'll tell gals is just because you've been told you have Hashimoto's now doesn't always mean that it's a lifelong thing. It's truly about, can we get to a root cause and figure out
Mm.
what controls that better?
So you're saying you can fix it.
You can fix it.
Okay.
Mhm.
Good to know.
For some women, yes, absolutely. And for some, it becomes management. How do we
Yeah.
manage it so that you're not struggling with and Hashimoto's is what I like to call a thyroid roller coaster, especially those TPO antibodies. I've seen them in the thousands, and then the next time they're normal again. And it makes it really difficult to truly assess, how do I feel?
Mm-hmm. For me, thyroid was the first thing I did get on. You were
Mhm.
advising me on this
Yep,
after when I was trying to recover. But then I was able to get off it because I got on testosterone. And once
correct.
I got on the testosterone, I was like, all right, I'm good. And I was able to get off.
Mhm.
And I've never been on it since, which
Yep,
nice.
since then, yeah. Like I
Okay.
just did my own labs earlier this week, and I have been doing a ton of traveling. So, which always is going to impact my gut health no matter how well I try to do. And I've seen a half point jump in my TSH from a month ago, just because there's been a few more carbs in my diet and just some of those changes that happen when you're eating from an airport and a hotel and things like that. So I got to experience firsthand just how my gut health changes are impacting my thyroid and some of my other hormones and symptoms as well too.
Mm, yeah, totally feel that. It's hard to stay consistent all the time. So Noella's asking about post-thyroidectomy. So does that mean thyroid is out?
Correct.
So what are recommendations for thyroid levels after that? Most of my research is for treatment management is based for those thyroids.
So that depends on why you had your thyroid out. So that's going to be a good conversation to continue having with whoever is managing. For gals who had thyroid cancer, typically the general thought process is keep that TSH as low as possible.
Hmm. Okay.
Basically, how low can you tolerate it? And I've had several gals whose thyroid TSH levels are undetectable because they've had a thyroid removed, whether post cancer. Now, if it's nodule, multitoxic goiter, there are a ton of different reasons that thyroid could have come out, and that's where I usually say lean on whoever is managing that, and don't be afraid to ask, why do you want my number where it is?
Hmm. Okay. Um, so Stephanie, I'm kind of curious what this one is. In July, my TSH was 83 and ended up in the hospital. Last week it was 0.86. T4 is 1.4. I am miserable. Okay. That seems like a wild
Do they know why? I mean,
thing.
my first question as a practitioner would be, do we know why that TSH jumped all the way up to 84?
Wow. Yeah, I don't know. We might need some more. No idea. Are you
And then
seeing someone? Maybe you need to
right,
see someone.
right.
Go
I
well, she obviously is getting tested, so that's good.
Yeah.
But
I almost wonder if the correction was too much. Because if
oh yeah, she said her
that was
heart
Stacy,
went
right?
down to the 30s, so maybe that it was she was maybe overdosed on meds then.
I wonder if
Hard to
it's
say. Hard to
yeah,
say.
it's hard to say. Um,
But it's certainly worth like
yeah.
finding someone who really can
if
help.
if you dropped from a TSH of 84 to basically zero point 0.8 in 30 days, that's a pretty aggressive treatment plan. 75 micrograms after hospital. So again, I'd want to see, what does your free T3 look like? Is this too, maybe it's an overdose situation, meaning your dosing is too high for your body right now. But so TSH comes from the anterior pituitary, which is also where the signal or the pulse to produce FSH, LH, melatonin, human growth hormone are some of those hormones so the brain tells the body to produce those hormones, and that initial signal comes from the anterior pituitary in the brain, which is where the TSH comes from. And a lot of times what I'll see happen is when you start to correct one, so let's say they're all slow and sluggish. Maybe they're all walking a 30-minute mile around in your body and you're feeling the symptoms of that slow sluggishness, the fatigue, etc. Well, a lot of times what can happen is as you start to correct one, so it may be for, was it, I think it was Stacy, as you corrected your thyroid, it may be that you truly also have an estrogen testosterone problem, which is now becoming more noticeable that the thyroid is optimized.
Mm,
But
okay.
like I said, I'd still want to know what T3 levels look like and potentially reverse T3 and cortisol.
Yeah, I mean, Stephanie, you have our information too if we need to help. I don't know if you're seeing someone good, but we can also get you an
Let's for
appointment.
sure dive deeper.
Yeah. Amanda said she was diagnosed with hypothyroidism 8 years ago and was put on levothyroxine. She
Yep.
got her labs done with a general practitioner and then again with Joy to see the full panel. Over the years, I saw my TSH continue to decrease, but now putting me almost in the hyperthyroid range, and my T3 has continued to decrease. Does that mean my medication isn't targeting the right thyroid levels?
Potentially, yes. So if T3 is continuing to go down, and again, I mean, we went back to the gut health. I'd also, in those instances, want to say, okay, what are FSH doing, or where are we at from a perimenopause, menopausal standpoint? But when you were started on the levothyroxine, probably a really great option at that time. But if T3 is continuing to go down and we're ending up hyperthyroid, this is a good time where I'll consider switching like to an NP or an Armour thyroid where you get the T3 T4 blend. So to give you an idea, if we just have a TSH problem, meaning your TSH is high and you're hypothyroid, then and your T4, T3 are normal. If T4 is a little bit low, it's okay. And T3 borderline but not super deficient, then levothyroxine or Synthroid is great because it just targets T4. It's basically pure T4, so it's targeting just that TSH. And the hope is that you're going to raise T4 enough that it's going to break down into T3.
Mm,
And then, as we were talking about, if we have any liver detoxification issues, it may be that we have enough T4, but we're not breaking down to the T3. But if we're deficient and have a T4 and a T3 problem, that's a lot of times where we'll have that conversation about the T3, T4 blends to bump up that T3.
okay, that's super helpful because actually was going to be something I asked you on my own, the difference between, because I feel like levothyroxine and
Yep.
Synthroid are kind of like they're out there a lot as like the what
Correct.
most people use. And
Correct.
they're fine, they're good to use. They're fine in some cases, right?
Correct. Correct.
Okay. But if it targets one thing versus MP, and then
Yep.
there's another one called Armor
Armor.
Thyroid.
Correct.
So
And those
that,
are both blends that
okay.
have T3 and T4 in them.
Oh, okay.
So if I'm struggling to get T3 up, I'm moving to an Armor or an NP and or adding it in.
Oh, I
If
see.
you just need pure T3, there's Cytomel, which is pure T3.
Okay. And is it possible that you start, so she obviously had this 8 years ago, that
Mhm.
you might need a transition. Like it might work for
Yes,
you for a while, but then after a while it's like you need something.
correct. Well, and the biggest thing I will tell people, and again, this is not a plug for Synthroid by any means at all, but levothyroxine is generic, which makes it dirt cheap when we go to fill that prescription from a pharmacy. However, the downside is that pharmacies, which a lot of people don't understand, when you're getting a generic, there is room for error and change. So let's say you're on a 100 microgram dose and the standard accepted error is 10%. Well, 1 month when you pick up your prescription, you might be getting 110 micrograms. And the next month you pick it up, you might only be getting 90 micrograms. So that's where we
This
can
is for a
see,
generic mass-produced drug?
correct? All
Oh,
generics. All generics have a room of error or a
interesting.
percentage of error that they're allowed by the federal government. So, and that's a lot of times why you'll hear branded Synthroid talked about a lot because when you have a branded drug, their percentage of error has to be much, much less. So let's say it's 1%. So 1 month you might get 99 micrograms and the next month you might get 101 instead of these 20 microgram swings, which can a lot of times, and I'll have some gals who pay enough attention who'll say, yeah, you're right. This month I didn't feel as good. This month I felt a little hyper. So you never really know what you're going to get when you're doing a generic, which can also contribute to some of those variations in how we feel.
Okay. That's interesting. Hmm. Um, if hashies and taking a good dose of armor, is intermittent fasting safe to do, or does that put too much stress on the thyroid? And how about low carbohydrates?
Depends on where you at in your phase of life. The more, and again, intermittent fasting is going to be a hotly debated topic in what I'm going to call the longevity and wellness space. Yes, we know there is benefit with intermittent fasting, but the closer we walk to menopause, us gals typically don't do well with intermittent fasting. What I usually, my recommendation to everybody is if you can go 12, maybe 14 hours from an intermittent fast standpoint, great. But you start pushing those 18, 20-hour fasts on a continual daily basis, and you can actually create more harm than good. So here's how I always like to think of it. So cortisol, that stress hormone, that fight or flight that we've all heard about, adrenal fatigue, etc. So cortisol is what spikes overnight, somewhere between 1 and 3 a.m., and keeps us full overnight. So what happens in the morning when we get up and we don't eat breakfast? So let's say you get up at 6 a.m., but you don't eat until 2 p.m. Guess who has to come to the table and continue to keep you full for that time period? Cortisol. What does cortisol do? Wrecks your gut, wrecks your thyroid, throws off all of your hormones. So the longer we end up fasting, the worse we can make things. And then a lot of times we fuel with caffeine, which further raises cortisol levels. So that's where things can get very difficult from that perspective. And why I tend to not be, especially as we get into menopause, where we don't have that resiliency, where we can handle those cortisol fluctuations as well. Where I typically tell all of my menopausal gals, and frankly, my perimenopausal gals, I don't really want you doing more than a 14-hour fast on a daily basis. Have some breakfast, and that breakfast should be some protein. And you'd be surprised how things kind of start to level out.
Yeah. I mean, I feel like as women, we can be generally like intuitive too with like how is
Yep,
it like helping you like really tune in to like how does this feel for me? Am I like
correct.
stressing myself out, or
Yep.
does it feel like the right thing? Like is
I can't
this
tell you how many like perimenopausal, postmenopausal gals are like, well, everybody says to intermittent fast, but instead of losing 20 pounds, I gained 5. Welcome to cortisol.
yeah.
Eat.
I
If you're
got
angry,
it.
eat.
I actually should look at cortisol levels. That I'm going to write that down because every time I talk to you, you're like, your cortisol's high. And then I saw you do that with another friend of mine, your cortisol's high. And so I feel like I'm curious if we looked at all of our lab tests. I bet most women have high cortisol.
I was pretty high at 6 a.m. when I did mine too. And I was like, oh, that explains a few things right now. Okay. Time
Mm.
to find some Zens, restart some meditation.
Elise is asking if Joy will help to get to the root cause and work on Hashimoto's. I will say this, we specialize in HRT. We are now training and adding on a thyroid program because it's so closely related. We don't work on, specifics like that. We're more generalists into this. I think we have some really great people that can read your labs and help, but I feel reluctant to say we will for sure work on Hashimoto's. I don't know what you think.
I will still say yes, not necessarily to the deepest dive that others may. Like we're not gonna we haven't implemented stool testing and things like that from that perspective, but all of my practitioners are certainly going to tell you, hey, what's your cortisol look like? What's your vitamin D look like? They're going to have a brief conversation about how we're eating from that perspective. So yes, we are going to peel back the layers of the onion to as deep as we can. But I also know when we hit that point where we're like, okay, this is outside of what I can do at Joy, we're not afraid to tell you, hey, here's something that I would recommend.
Yeah, that's a good answer. Okay. So Tracy's getting at least 25 grams of fiber from a diet a day. That's great to know. I have no idea what I get. What other things can I do to help my gut?
Protein, protein, protein.
Protein.
Um,
What do you think about
Ladies,
probiotics? Does everybody need to be on probiotics? I don't know.
oh, generally speaking, yes. And then everybody's going to ask me which probiotics. I have no idea because I don't know what your gut health looks like. I do know if you've recently had COVID, that bifidus is, so I always tell people if you've had COVID or a recent viral illness, bifidus is a big one to replace because it gets completely obliterated. Um, Usually what I tell you from a gut standpoint is eat the rainbow. Leafy greens are going to be great. Like we talk about selenium, iodine is crucial for thyroid health, zinc, iron, but in the right balance. So as long as you're eating some fruits and veggies, getting some protein, generally you're supporting your thyroid in a pretty healthy way.
I've heard that colostrum helps, and I have no idea if that's just marketing or not. Have you heard of that?
Generally speaking, I think it's marketing.
Okay. And then
I
like
think you'll get far
collagen,
more benefit from some of the foods you eat. Add in some nuts, some legumes, leafy greens.
stuff that feels good on your stomach.
Correct.
Okay. All right. It's not just an easy answer.
It never is. That's the problem.
Okay, what do you consider optimal free T3?
I generally will tell my patients between 3 and 5. Newer research is showing that actually 4 to 5 is probably more optimal. A
Okay.
minimum, generally, all the newer support research is supporting at least a free T3 of 4.
Okay.
I've had some people drift upwards of 6 or 7 who don't have any hyperthyroid symptoms and are doing well and thriving there. So I also believe in meeting people where they're at.
Yeah,
But
so it's like a combo of optimal levels plus symptoms.
symptoms too.
Great.
Correct. Yep.
Okay, so we already answered this, I think, your thoughts on compounded thyroid meds, because is that the NP
So
thyroid?
you can still get NP and Armour thyroid from a commercial pharmacy, a Walgreens, a CVS, any of those.
Okay.
Now, but obviously those are going to be set micrograms and set blends, so to speak. So, 30, 45, 60, 90 milligrams. If I need somebody who needs something a little bit more, yes, I can get that from a compounding pharmacy. So I don't have a problem with a compounded thyroid. A lot of times I will still typically try and do a blend from a commercial pharmacy, but if we're definitely hitting that wall and we need something more specific for the patient, then yes, I don't have an issue with compounded.
Okay, great. So Melody is asking, should she see her doctor? She takes thyroxine 75 mgs. My number is 5.6 on the TSH.
Ooh,
Legs are in pain and pain sometimes sharp.
yes,
Yeah.
that level is not adequate. And so here's something I will always tell everybody too. As a practitioner, it does me zero good if you take your thyroid medication that morning and come in for labs.
Mm. Okay, so
Always
don't
hold
take
that.
your thyroid
Don't take your
morning after
thyroid
labs.
medication that morning of labs. Just because you can really throw off numbers to the point that your practitioner who's managing that will tell you, yep, everything looks great. I'll see you back in 6 months. And you spend the next 5 months and 29 to 30 days feeling miserable because that level isn't where it's actually truly running.
Okay.
And yes, we always talk about taking thyroid on an empty stomach, avoiding your vitamin C, any acid reflux medications with those. And I do agree with that. I will tell my gals though too, don't set an alarm at 5 a.m. just to take your thyroid medication separate from everything else. Just be consistent. Like, yes, ideally, I would love for you to take it separate from most of your other supplements. But if 30 minutes is all you can do, or 45 minutes is all you can do, just be consistent and we'll see that on labs and can make adjustments appropriately.
Okay, great. I love this question. What kind of hormones do you recommend? Bioidenticals or Premarin? I
Um,
have
if you are on Premarin or have been suggested Premarin, please run the other direction.
Yes, we know what that is. Conjugated horse urine, right?
Yep. Pregnant horsehair mare urine.
Yes, bioidenticals for sure.
Yes.
Um, that the Premarin was done in those studies that the
Women's Health
WHI, right? That's
Initiative.
what they
Yep.
used.
Mm-hmm.
That kind of scared everyone in the 2002 study that came out that said hormones were bad. Everyone was on
Correct.
Premarin then.
Correct.
Um, okay, another question. I have difficulty reintroducing some veggies due to oxalates. Any recommendations? I don't even know what's an oxalate.
Yeah. So there are some over-the-counter type supplements that you can help from an oxalate standpoint. And if you can't tolerate veggies, just stick with the things that you can. But typically you can do like there are some like biodigestive enzymes type stuff that will help with the oxalates.
Mm. And Katie missed the comment about coffee caffeine. Was it just for fasting? I think the whole point of that was stress, how much are you stressing your body? And especially during perimenopause and menopause. And it's fine for some people. We're not saying you have to give up coffee if
Correct.
it works for you.
Correct. Usually what I tell my gals is if you're going to be a coffee fiend, limit as much as you can, like limit your caffeine as much as you can. And I usually will tell specifically my perimenopausal, menopausal gals, don't have your coffee in the morning without some protein, or have some protein first and then have your coffee, just because you will dampen that cortisol response that happens.
You were over at my house not too long ago, and I found out I was trying to serve you coffee, and you said you don't drink it
I have
anymore.
never had a cup of coffee in my entire life. I'm a
That's
caffeine
crazy.
free girl. Yep.
That's wild. I try to do half caffeine now, and I do put it with fat,
Yep.
with yeah, stuff, so it doesn't get me too jittery. Okay.
Yep.
Wonderful. This was awesome. I think we have hopefully answered all the questions. If there's any more, put them in here. Um, but I think that we're good. Riley, have we missed anything?
No, we nailed them all in the chat. There were some from the Typeform link that I can just announce out loud, and they're pretty good
Yeah.
questions too, just for overall thyroid health. So the first one was, are there supplements that help detox the liver?
Yes, there are some supplements that help from a liver detox standpoint. NAC is one, and acetylcysteine, glutathione is another one. But again, I'm also going to go back to what we're putting in our mouths makes a difference too. Minimizing the alcohol, eating your leafy greens, your fruits and veggies that are going to support that liver health. But typically my go-tos from like a liver standpoint, and the hard part is too, is there's different phases of liver metabolism. So it's also trying to understand, where do we think we're having problems from? Um, the woo-woo in me also loves a good ionic foot bath, where you can pull some of the
Cool.
toxins out too. So,
I
but if
love
I'm
some
doing,
woo-woo.
yeah, I love woo-woo stuff too. If I'm doing supplements, usually NAC and glutathione are kind of my go-tos.
I have a woo-woo too. I actually would like bring this up because we're talking about liver, gut
Yep.
health. I can't say that there's studies that point to this, but I swear by my castor oil. I
Yes.
personally love to put a little bit of castor oil on my stomach and over my liver before I go to bed. Every night I
Yep.
do it, and it
Yep.
helps me go to the bathroom. And I obviously I have no idea if it's helping detox liver, but that's what it's supposed to do, right?
The fact that it helps you go to the bathroom is your
Okay,
sign that it's helping your liver. I love a
okay,
great castor oil pack as well too.
good.
I do
A
it
lot
every.
of days when I'm in tennis shoes, I'll actually rub it on the bottom of my feet
Mm.
and then put my socks on over too. But
Oh, because putting it on your feet will draw stuff out. Is that what it does?
correct. Yep.
Nice. I've never done that. I do put it a little bit in my around my eyes too. I feel like
Uh-huh.
skin nice.
Yep. It's vitamin
Right.
E.
You
Castor oil
use
is
it too?
basically
Oh my gosh, all the
a vitamin
time.
E.
Oh, nice.
I love it.
Great.
Yes.
So
Yeah, there's
foot
just
baths
two
and some
more.
castor oil on your liver. Look at us. Love it.
I haven't tried the eye on one yet, but yeah.
It's pretty enlightening, and it's pretty gross to see what gets pulled out of your body.
Mm, mm. Okay. Amazing. Riley, are we good or anything
Did we
else?
answer anything?
I would just say this last one is pretty good. So, how does
Yeah.
pregnancy and breastfeeding affect thyroid health?
Well, thyroid's a hormone. Pregnancy takes your hormones on an absolute roller coaster, as does breastfeeding. So 1,000% it has the potential to impact that thyroid gland. You're taxing it as well. And it's part of why we check it both in pregnancy and post-pregnancy to figure out, do we have any alterations? Is it impacting? And that thyroid is crucial to fetal development as well. But it's a stressor on your body. I mean, just the fact that you're pregnant and breastfeeding, and always has that potential to throw thyroid levels off.
Big stressful. Stacy says, thank you so much. I are saying thank you. I'm going to let us answer one more because
Okay.
Mel says, do you think Joy Wellness Labs would help me feel better? I'm 60 years old. And I will say,
Yes.
from my perspective, like, what's your goal? But like, we would look at thyroid, we would look at hormones because that's maybe some options. I don't know what you would say, Melissa.
Yeah, my easy answer is absolutely yes. At 60, I'm going to make the assumption that you're a perimenopause or a postmenopausal female. I don't know how long postmenopausal, but making the assumption that you're postmenopausal means that you have no estrogen, no progesterone, no testosterone left in your body, all of which things, well, we talk well, Katie and I talk symptomatically a lot too. I mean, and I'm going to diverge away from thyroid here for a minute. And estrogen is finally getting some of the noise it deserves, but I don't think women understand just how important estrogen is. There's a reason we see an increase in heart attacks in women who are postmenopausal, and that's because of the role that estrogen plays in cardiac health. It also plays a role in insulin and glucose metabolism, bone, osteoporosis, all of those things. So I always kind of joke, I can't tell you how many postmenopausal gals who I see who are just like, all of a sudden I saw my primary care and my lipids are borderline and they want to put me on a statin. My blood pressure is high. They're talking about putting me on a blood pressure medication and now I'm borderline diabetic. Like, what happened? I was perfectly fine 5 years ago. And I'm not saying that hormones are the end all be all, but I would be remiss to say if nothing had changed in 5 years other than the fact that you went through menopause, that's a pretty solid place to look. And just like you heard me talk about earlier, when you get that menopausal decline in estrogen, progesterone, testosterone, typically that also means you're getting a decline in aging, decline in melatonin, which affects sleep. You're going to get a decline in thyroid. So all of these systems in the body take a pretty big hit and can get impacted. So even if you're asymptomatic, it doesn't mean that there's not still benefit to be had. And I'm also a big believer in knowing your numbers. At least do labs and know what everything looks like. You might be shocked what your vitamin D level looks like and how you feel with a little vitamin D supplementation.
Yeah, stuff that could be easy to fix. Melody learned about us from the laundry lady, which is Meredith. I love Meredith. She's one of our partners. I met
Yeah.
her on a call a year ago, a separate call, and she was like, I need help with my hormones. And I was like, I'll help you. And because she was having so many issues, and she says we've changed her life, and now she's working with us.
Awesome.
But she has this really cool laundry product that like is dried sheets. So you
Oh,
just,
cool.
so it's like, it's really light and it's so like
Yep.
shipping is cheap and it's like all non-toxic. I love it. I use her laundry too, but
That's fantastic. I
she's
love
off.
it. I see the comment on here of somebody saying that they've been with Joy since April, slowly starting to feel better. I always want to say the caveat when we're talking about hormones, I always like to use the line, we didn't get here overnight. We're not going to fix it overnight. This is not, hey, in 30 days, in 90 days, everything is going to be magically perfect. It takes time to figure out how does your body respond. And it requires you paying attention to your body a little bit too, as to what makes the differences for you. Like I actually just had a conversation with my husband last night. I love carbs. I'm definitely a good Midwest girl, but I noticed I was in Salt Lake City over the weekend for a conference. I had been fairly low carb over the weekend, came home again, kids, things like that, where I'm going like crazy. And I was driving to work yesterday and I was just like, gosh, I'm starting to feel my joints ache a little bit. And I told my husband, I'm like, I think it's the increased carbs I've done since
Mm.
we've been home. It's just, and it's paying attention to those small things. And my testosterone's where it needs to be. My estrogen is where it needs to be. My progesterone's fallen off a little bit. My cortisol's high. So it's taking a look at that whole big picture to say, what makes the most sense for you as an individual?
I love it. Beautiful. Melissa,
Yeah.
thank you so much. This is like so amazing that you took the time to do this because it's not easy like having just random questions thrown at you.
I
So thank
love
you
it.
so
They
much.
were great questions. And I always love
Um,
doing this. I love having
yeah,
the
thank you.
conversations.
And Stephanie, I see you. We're going to make sure you have a thyroid ex person on your next call. Stephanie Nelson. I wrote down a note for that. So we make sure we're
I'll
looking
make
more
sure you
closely
get
at
taken care
thyroid.
of, Stephanie.
Yes. Thank you, everybody, so much. Thank you, Melissa.
Have a
Thank you,
happy
Riley.
Friday.
Have a great weekend.
Take care.
Bye.